You're welcome to Sight Ed, a sight educational program designed to enlighten every one of us about eye health issues. Our business is preserving vision and restoring sight. Today's episode, we're going to be looking at some systemic diseases that can affect the eye. And I must tell you there are several of such systemic illnesses that have consequences on the eye. That is one of the reasons why actually we say the eye is the window to the body. Because by looking at the eye, we can get to know several diseases going on in the general body. So that is one opportunity you avail yourself when you go for regular eye checkup. So today we're going to be looking at some common systemic illnesses that can affect the eye. And to do justice to this, we have actually interviewed another expert, a consultant ophthalmologist, who will be talking to us about various systemic illnesses that can lead to blindness or that can affect the eye. We interviewed Dr. Chinyere Pedro, and she will be taking us through this segment. And of course, as usual, we also, at the end of this interview segment, we will continue watching the film on glaucoma, the still water. I want to believe that you're getting several lessons from this film. And also don't forget that you can always contact us on this program with your questions and comments through our social media outlet.
My name is Dr. Chinyere Pedro Egbe. I'm a consultant ophthalmologist at the University of Port Harcourt Teaching Hospital and an associate professor of ophthalmology at the University of Port Harcourt College of Health Sciences, River State. Okay, we have an eye model here, so I'll show you what the optic nerve is. So this is the eye. Now the optic nerve is this tub here. It's like a cord that connects the eye to the brain. So this is the optic. So what we're going to be talking about today are things that affect the optic nerve. When in neuro-ophthalmology we're talking about systemic diseases or even things that are occurring in the brain and then manifesting in the eye, and some directly in the optic nerve, some inside the surface of the eye. So when we're talking about systemic diseases that affect the optic nerve, we're talking about problems within the body that affect the nerve, and there are quite a few of them. We'll start with the common ones. Diseases such as high blood pressure, hypertension, that is if it's not well controlled, diabetes, high cholesterol level, sometimes also what we call sleep apnea. Some people, when they are sleeping, it affects their breathing. So in between they have, like shortness of breath and they have to wake up. So these are some of the conditions. Also the kind of food, if we're not eating well, because the nerve, for it to function well, it has to be healthy. And some of the foods we eat provide that nutritional aspects for the health of the optic nerve. We're talking about foods that have a lot of vitamin B's in them, like green leafy vegetables. There are also other systemic conditions. We've also found that women of childbearing age, not all of them, but some, are predisposed to having swelling of the optic nerve head, which if not well managed can ultimately lead to blindness. And this swelling of the optic nerve head, which we call papilledema, is actually commoner in young obese females. When we talk about young obese females, mainly those in the childbearing age, 15, 16, up to even 45 years of age. There are so many of them, but I just want to mention a few that we can easily relate to. Sometimes you don't know, but one of the commonest symptoms is the patient presenting with poor vision. I was seeing before, I'm no longer seeing well. That's one of the commonest presenting symptoms. Or they tell you, oh, Colors, I'm looking at things. This red, it appears a bit washed out. It's not very deep. So, but sometimes you actually find it that somebody has an optic nerve problem on routine eye examination. You know, somebody comes in to have their eyes examined. They don't have any illness. And then when you examine, you look into the eyes, you will now discover that the optic nerve, there's some kind of disease. In the early stages, you may not know. It's only when it's later that your vision starts going down. My area of interest in ophthalmology is what we call neuro-ophthalmology. So we just mentioned optic nerve disease. There are other disorders in the body too that, you know, affect the eye generally. And this situation, somebody may say they have their upper eyelid is drooping, that is getting lower than normal, or they say they are seeing double vision, and it can be very troubling for a patient to see double vision, because if you're driving, then you cannot drive because you're seeing things too and you can get into an accident. So those are some of the common symptoms the patients present with. So it's when you look further, you can now say, oh, this is due to optic nerve problem. This is due to some other problems in the brain. Then, when we talked about some of the systemic diseases, something like even the stroke, we talked about hypertension and the optic nerve. It causes problem with the optic nerve, like swelling of the optic nerve. If it's not well managed, the person can go blind. All these things I've mentioned, if it's not well managed, the person can lose vision. And that is why it is important to have your eyes examined at least once a year. If you have any of these diseases I've mentioned, diabetes, hypertension, you have to be properly managed by the physician. You understand? With the good control, then you won't have any of these problems. Even where they are there, you are able to control them, and then you won't lose your vision. But if they are not controlled or poorly controlled, eventually you will go blind. The first one is you manage your systemic problems. You manage, because some of these things, once they've happened and the process just progresses, and then you lose vision from it. So regular complete physical examination, where you know your blood pressure, your blood sugar, your cholesterol level. If you have any of these things, then they must be managed by the physician. That is one. For somebody who is obese, we talked about when there is a rise in the pressure in the head and the swelling. It's been found that if you lose about just 8% of your body weight, you know, will cure it. So maintaining the normal body weight or something as close to normal also helps. Then when it comes to nutrition, eat well, eat healthy, not junk food. And when you're eating a lot of vegetables, green leafy vegetables, we have a lot of them around here. Food that contain vitamin B complex, the carrots, all those things. Eat healthy, you will be fine. Your eyes will be protected. And then for your eyes, have regular eye examination. You don't go to the eye specialist only because you are not seeing. Because some of these things can be picked up early. And then with proper management, you'll be able to retain your vision. But where you don't do this, yours truly, you can say goodbye to your vision, which is the 20/20 vision. Or you just be functioning with poor vision, what we call visual impairment. Since we're talking about systemic illnesses, and we know that compliance with treatment is a huge problem, not only in developing countries, but also well-developed countries. We've also had experiences of patients taking their drugs just before they come to see the doctor. But here's the problem. It is difficult for the doctor to monitor every patient they see, because you can't go to their homes and tell them take your drugs at this time, you don't know what they are doing. The best you can do is counseling. And in the counseling, you tell them about this disease, and you tell them about the importance of, proper control of either the blood pressure or the the blood pressure or the blood sugar level, and that without this, that they can develop all the complications we talked about before, this swelling with resultant loss of vision if it's not properly managed. So I think the key here is counseling, and you can never counsel a patient enough. So you just keep doing it. Anytime you see the patient, you keep saying the same thing. You keep saying the same thing. And if you have the means, you can actually even remind patients, maybe even if it's once a week, about their drugs. Have you taken your drugs by text messages? That is, if you have the manpower. Presently, our manpower is we're kind of short of manpower, so we're just managing with the very few persons we have to work with. But this is the way to go if we're going to get any results. As patients, that we must take our drugs as at when due. Don't wait until you come to the doctor. Luckily for us, for something like diabetes, there are particular tests you can do that will tell you what your blood sugar control has been over the past 3 months. So if you come in and you just took your medicine the day before you came in or that morning, and we take your blood sugar and it's fine, and we did this and we do this special test, it will definitely tell us that you've not been very consistent or you've not been very compliant with treatment. So the key is take your medicines as at when due, and then you'll be fine. So my take home is that we should have regular, not just eye examination, but complete physical examination. And when we have systemic illnesses, they should be properly managed. Thank you.
Thank you very much, Dr. Chinyere Pedro, for that exciting and illuminating segment. We are very grateful. You're still on Sight Ed, a sight educational program designed specifically for you and for myself. And I remain your host, Adepo Jufeyi. All right, now we're going on to watch the short drama clip, still on the film Still Water. We do hope you enjoyed.
Glaucoma can be hereditary. I think surgery can be an alternative treatment.
How do you know that?
I just searched through net now, and that's what I'm seeing. Why is the doctor not asking you to have a surgery?
Surgery?
Yes. Why?
I remember very well. You just came in for checkup the other time when we noticed that you have glaucoma. And after we offered you surgery, everything has been fine.
Thank you. Thank you very much.
As usual, Baba, your pressure has always been within the normal range, between 10 and 20. Like we used to say, Baba, when people come early, on time, the patient will be happy, the doctor will be happy.
But doctor, me looking at Chiku, it looks normal.
You are very correct. There is a nerve at the back of our eye that glaucoma normally affects. Now, when people look at a patient with glaucoma, they will see nothing on the outside. At the end stage of the disease, the patient himself will see nothing.
But this may cause him his job. Doctor, I'm afraid, since the vision cannot be restored.
I need to let you understand that he needs your support and encouragement now more than ever before. The vision cannot be reversed actually, but we can rehabilitate him. We can offer him low vision services that will still make him useful and productive. What I will suggest is you probably put him in another department in your institution. And I think it is also necessary for me to also let you know that we need to have that change of attitude to people who are visually challenged. Well, they need our encouragement. They need our support. And lastly, I also want to suggest that you allow every member of staff in your institution to be coming for regular eye checkup. For people who do not have family history of glaucoma, they may come once in 2 years. For those that has, maybe once in a year. That will be very important.
Thank you, doctor. But give me some time to think about what to do.
Mr. Chuku will be placed on some drugs. Please encourage him to use them religiously. Surgery is also available. It's cheaper on the long run. Please also, he should not fear having surgery. I think that would be...
Look, I have waited for so long and I am very, very hungry. Abba, Dokita, look, you operated this high, this very high, and yet I can't see with it. And yet I know so many other people that you operated that high, and yet the next day they have started seeing with it. Look, you just made me to waste my money and time. The money I ought to have spent in marrying the third wife. You made me waste it.
Mr. Willis, please come and have your seat, please.
No.
I'm not sitting, sir. You have been our patient, and you understand what goes on here. Well, first I must apologize to you for the delay. I'm so sorry. But also, you have been our patient for quite some time, and we took time to explain your condition to you. What you have is glaucoma. And the time you presented it was already advanced. If you had come much earlier, we would have been able to preserve useful vision for you. So I think that is what is happening. Those people you refer to, they have cataract. With cataract, once we operate them, they will be able to see almost immediately. So, and that is what is causing the confusion. Please don't be annoyed. Once I'm through with this matter, I will call you in, please.
Chinko, 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 chin.
Grandpa, what did the blind see?
I see darkness all around me.
If you can see again, what would you like to see?
If I can see again, I would like to see my granddaughter. Especially the one asking this question. And I would like to see my children. My son, my daughters, and my darling wife. And I would like to see the food I eat.
Good day, doctor. Good afternoon. Please sit down. Sir, since last week that I met you, there is this strange feeling in me that I know you somewhere. And sir, which village are you from?
Oriaka.
Oriaka?
Yes, doctor.
Sir, do you know one Mr. Bernard from Ogum clan in Oriaka?
You mean Bernard Onondudubu?
Yes!
My friend that died about 10 years ago?
Yes! He was my uncle. Sir, can you recollect one day that you brought Papa from the hospital to the village?
I will make sure I become a doctor when I grow up and treat all the people that are blind in this our village.
That's very good. That's good. But you need to put this in your mind. You must read your books. Read your books well.
Jude.
Yes.
Jude, you are now the eye doctor.
It's me.
Jude. Jude.
Oga, you do okay?
Are you sure?
Oga, you no trust me again.
What about the cobbler I saw here the other time?
Oga, he don't blind though.
Blind?
They say they hospital. The doctor said sickness is irreversible from glaucoma.
Glaucoma?
So you know him, glaucoma.
Glaucoma is not a human being. It's not a person. It's a silent thief of sight that must be arrested early by going for regular eye tests. Why are you pressing your eyes?
Oga, nothing.
Do you have glaucoma?
No, Oga. Go for visa.
Go for an eye test.
Alright, sir.
Okay.
Thank you, sir.
Check your eyes before you become a victim of glaucoma. If you have done a test before, make it regular.
Alright, we'll soon be drawing the curtain at this episode of Sight Ed, a sight educational program specifically designed for you. One or two quick things we hope you have learned from the film so far. One, the fact that glaucoma is a silent disease, it's painless, it's symptomless until the very end stage of the disease. Number two, that we expect that everyone that is 35 years and above will routinely go to check their eyes and be sure that they don't have glaucoma. And three, for today, is the fact that everyone who has glaucoma need to specifically invite their relations, children, brothers and sisters, to go and check their eyes because glaucoma can and do run in the family. Until next time again, I remain your host, Adepoju Feyi, on Sight Ed. Thank you.